Hello, my name is Leslie,
And I'm Rose.
and we are going to be presenting Clostridium tetani. C. tetani, which is Clostridium tetani, is the organism for the disease known as tetanus. Tetanus can be life-threatening if left untreated, and it can also cause painful spasms, tightening of the muscles, especially around the neck and jaw, and it can interfere with a person's breathing. A tetanus infection can be prevented by the vaccine. For the epidemiology of C. tetani, in the US, the annual incidence rate for tetanus is very low. It is only about 30 cases. Most of these cases occur in people who have not been properly vaccinated. The organism C. tetani is most common in developing countries, especially in areas that have natural disasters. The reason it is most common in these areas is because they lack immunity, especially in areas like Afghanistan and Pakistan, where the rates are about 70 cases per every 100,000 people. And the people that are at highest risk for a C. tetani infection is children and the elderly. For the economic burden, there is not much economic burden in the US because there are very few cases. However, for an adult that is unvaccinated and they are being treated for a tetanus infection, it can cost around $22,000 to about $1 million in treatment. For the agent, C. tetani is a bacteria. For the morphology and appearance, it is a gram-positive rod-shaped spore-forming bacteria. For the virulence factors, C. tetani produces two exotoxins, tetanolysin and tetanospasmin. Tetanospasmin blocks the inhibitory nerve impulses, and it does this by interfering with the release of some neurotransmitters, which can eventually result in paralysis. The classification of C. tetani is Clostridium, and the natural habitat slash living conditions for C. tetani is that it is an obligate anaerobe and it can survive in extreme temperatures, both indoors and outdoors, which can make it very difficult to get rid of in any environment. The interesting life cycle is that it cannot grow or reproduce in the presence of oxygen. When this bacteria is exposed to oxygen, it forms a protective spore and it lies dormant. The spore is resistant to things like heat, household detergents, and disinfectants. And because of the spore, this bacteria can lay viable in soil for many years until the environment becomes favorable and then it will be reactivated. For the metabolism, it is obligate anaerobic.
So, C. tetani enters the body from the soil into a deep cut leading to dead tissue. Since the bacteria grows well without oxygen, dead tissue gives it the space to grow and spread. Tetanolysin is a cytolysine that damages tissue by increasing the permeability of cell membranes around infection site and uses the condition to multiply. Tetanospasmin, otherwise called tetanus toxin, is a neurotoxin that is released due to cell lysis after the bacteria grows in anaerobic conditions. The job tetanolysin has is to increase the amount of tissue depth so that the infection can spread. While tetanolysin is making way, tetanospasmin uses this way to cause tetanus. This tetanus toxin binds to the presynaptic membrane at the neuromuscular junction, is internalized, and is transported to the spinal cord by the retrograde axonal transport. Here, the toxin is transported across synapses and reaches the inhibitory neuron terminals. While here, this neurotoxin blocks the presynaptic release of the inhibitory neurotransmitters glycine, and GABA from being released. These neurotransmitters induce muscle relaxation, but without its presence and the continuous release of acetylcholine to the muscles leads to the irreversible contraction of the muscles.
For the clinical outcomes and diagnosis, some of the symptoms of a tetanus infection are painful muscle stiffness, involuntary muscle spasms, jaw cramping, trouble breathing, headaches, and fever. And for the clinical test and diagnosis, in order to be diagnosed with tetanus, a doctor would have to do a physical exam looking for the signs and symptoms of tetanus, like jaw cramping, muscle stiffness, headache, and fever, and trouble swallowing. The doctor may also ask questions to determine if the patient has been exposed to C. tetani. There are no lab tests that can be done in order to confirm a tetanus infection.
What is a treatment, you may ask? Well, in order to treat someone who got infected with C. tetani, the wound is cleaned and tetanus immune globulin is given at a dose of 500 units. This provides an immediate protection against the bacteria. It contains a large amount of antibodies collected from donated human blood. Afterwards, measures are taken to eradicate C. tetani from the body. These measures use antibiotics to stop its reproduction process as well as stop its spread. This is done with intravenous metronidazole 500 milligrams 3 times a day, or with penicillin 100,000 to 200,000 international unit per kilogram per day. These antibiotics prevent the bacteria from multiplying and producing the neurotoxin that causes tetanus, and they are continued for 7 to 10 days. In order to prevent one from getting tetanus, 4 kinds of vaccines are used today. Tetanus toxoid is given along with diphtheria and acellular pertussis absorbed vaccine as a booster vaccine called Tdap or DTaP. A booster vaccine is a vaccine given periodically to boost the immune system. 5 doses of primary immunization is scheduled for children under 7 years of age. The first 3 doses of Tdap is given intramuscularly at intervals of 4 to 8 weeks. The 4th dose is recommended at 15 to 20 months, but should be after at least 6 months from the 3rd dose. The 5th dose is given between ages 4 and 6. For those who cannot be given pertussis vaccine, DT for pediatric use can be given. For those over 7 years, TD for adult use can be given. So stay vaccinated. Thank you.
Thank you.